Christina, right?
Yes.
Christina's your name. Okay. So.
So, and some of this will be personal information because we are going to go over your health
Yes.
history. Are you fine with that
Yes.
being recorded as
I'm
well?
fine with that being recorded.
Okay. So then tell me a little bit more about what brings you in today.
So I started trying naturally to conceive about 2 years ago.
Okay.
And it was just a mutual situation and a friend who understood what I wanted. And so we tried a couple times for home insemination. No luck. No, nothing happened. So I went to the doctor, got all my blood and everything checked to make sure everything was cool. And when nothing was happening, I'm like, okay, well, let me go and make sure everything is cool. And so my doctor was like, well, you want to get your egg count, done. So fast forward, I went to a fertility institute out in Oak Brook and had the AMH checked, and it was 0.27.
Okay.
0.27. So at that time I wasn't insured like I am now. So everything was cash out of pocket. I was only able to do the consultation and then a blood draw.
Right.
And then at that point I had to stop because it was the HSG that had to be performed when they do the
the saline ultrasound.
yeah, so I would have had to pay cash out of pocket for that. Didn't have that
that's
$3,000. Yeah. So I just kind of put it on pause and I said, you know what? I really don't know that I'm infertile. Not understanding that there's a lot of background information about being 43 at the time that doesn't necessarily have to do with the egg meeting the sperm and so on and so forth. So fast forward, out of nowhere, I end up in the ER. I find out that I have fibroids.
Okay.
The pain was presenting as being unable to finish urinating. It was just like I'm not finished, I can still go.
Right.
And then it was like a severe abdominal pain. And then it was like, am I constipated? And it was just really confusing down there.
Right.
So that's when we discovered the fibroids. I went to a gynecology specialist. He was like, we need to get you an MRI. There was 3. They're all measuring under 3 centimeters or 4, whatever the max is that they don't want you to go over.
Right.
So he's like, well, they're fine as long as they don't get bigger.
Right.
They may burst, they may dissolve. He says, but depending on where they are, that could be preventing you from getting pregnant.
Absolutely.
I was like, oh, okay. I see him for a few months. I follow up. He gives me tranexamic acid to ease the blood flow. He did, at one point he performed a biopsy. I got another MRI to check the growth of them. And they're not necessarily blocking, but there are, of course, they're in some spaces that are occupying what I need to flow naturally.
Absolutely.
So no blockage, but he says, you know what, I've taken you as far as I can take you. He had me on the tranexamic acid. It really lightened my period. I did not know. And I had been bleeding heavy for like 5 or 6 years now, if not more.
Okay.
And no endometriosis, but just extremely heavy periods.
Okay.
I just thought, oh, okay, I'm just one of those girls that flow heavy, not knowing that's not necessary. You don't have to be bleeding that heavy. you know, it's not quite normal.
And it could have been if your body did have fibroids that were also kind of just draining and bursting during that purpose. It was going to be a little bit bleeding.
Yeah. So mentally I was like, I'm not infertile, but I was like, there's nothing wrong with getting help to seeing if you can have, an answer to your questions. And I didn't step into it knowing that I would want medical aid assistance getting pregnant. I just wanted to find out, okay, what's going on? Okay, well, let me go do this on my own. That wasn't working. So after a few more tries for home insemination, I had a chemical pregnancy.
Okay.
And not knowing why or what caused it or why they happened, I later find out once I got the biopsy and the MRI. They were non-cancerous, no cancerous cells. The MRI showed that there were, some nice fibroids there, about 3 of them. He said, this is as far as I can take you. He says, you're going to need to switch your insurances and you're going to need to see a reproductive endocrinologist. So I had been working with him for a year And this past January, I got an RE, saw Miss Dr. Jelani, and she's been wonderful. I've been working with their whole team. Everything's been fine. After I realized that I had to have a hysteroscopy.
Okay.
So they did remove a polyp, which, of course, explained the chemical pregnancy.
Absolutely.
And I thought, okay, well, she said, had you gotten pregnant before now, it could have been a preterm labor, a difficult pregnancy, if not a miscarriage. Mm-hmm. So it was a blessing in hindsight, of course, that all those times I tried for home insemination did not work. And that chemical pregnancy happened the way it did because
otherwise they wouldn't have known to look. And it is very common with chemical pregnancies, especially even if you do the at-home test, they'll tell you. Even it's way buried in the instructions because no one reads that little pamphlet. They just go.
And I only read so far.
Yeah, they're like, okay, pee on a stick, plus or minus, let's go.
Yeah.
But it is in there where you could still take a positive pregnancy test and have it show that you're pregnant and it actually just be a cyst because it's going to just be giving off different levels. So.
Wow.
Yeah.
Wow.
That's why they have a whole pamphlet.
Yeah. I read a little bit of it, but I didn't read that far, obviously.
Well, yeah, and it's really, they'll even tell you, they'll be like, wait till you're like, I think they say like 19 days after your missed period to like even take a pregnancy test for it to be sure, because then if it is a cyst, it will see differently. So that could have caused a chemical pregnancy. Also, if, say, implantation did happen, but it didn't implant where it needed to where it could have been in the fallopian tubes, which is an ectopic pregnancy.
Right.
That could have happened, and as long as the body naturally gets rid of it, you would never know unless like, you went in, they did an ultrasound, they're like, oh, we see that this implanted here.
Yes.
So, I mean, chemical pregnancies, while you don't hear about them a lot, they can happen and people might not even know. Yeah. So, just because it could be a polyp that, unless you were trying to get pregnant, you wouldn't even know.
Gotcha.
Even say with an ectopic, you might not be trying, or you might be trying and not go long enough to where you have to take a pregnancy test. Yeah. But the body would just naturally get rid of it.
Okay.
Just with
I've read about that too.
So, yeah. So I mean, there's a lot of times where it could be happening and you wouldn't know.
Yeah, I've been reading. Well, since then, of course, all this research that I've done up into, all the information that I've gathered, everything starts to collect and make sense during this journey, so not that I'm an expert by I mean, none at all, but everything that comes together, it just clicks. Everything you're saying clicks because you don't know why until you start seeing a doctor and until a doctor explains or a professional tells you, well, yeah, that happened, that's what that was. Oh.
Right.
So everything is clicking and making sense.
Yeah.
Stuff that would have overwhelmed me then.
Absolutely.
Or, caused me to just break down.
When it comes to the uterus, there's so much information out there. And that's just for the uterus. Then you have the fallopian tubes and the ovaries. Like, it is this whole complex system that everyone's always trying to figure out. And it's literally like that bratty child that just never wants to clean its room. And you're like, no, I need you to clean your room. And you're like, no. And you're like, what do you mean no? Yeah. So kind of all the information and then trying to figure out, it's a very uphill battle. It's very overwhelming because
I'm very overwhelmed.
Yeah, you're trying to do something and you almost feel like your body's fighting against you, where it's not necessarily doing that. Your body just isn't necessarily the same every month to month based on where hormones are at, where your uterus decides, like what your uterus decides it wants to do today. Yeah. It's a whole different, so it's very hard to be an expert just because
it's ever learning, it's ever evolving. So there's no one answer, there's no two solutions, there's no nothing. Right. There's no rhyme.
And what might work for one person
doesn't work for another.
Will not work for the next.
Yeah, that's why, doing this channel and putting my journey out there is helpful and it's informative to different women, different couples. And for me, watching other channels, because it's like, you can't necessarily say, oh, well, I want to try that. You can just know and you can just understand that that's a part of what could be an issue, or you can ask your doctor and allow you to be more of an advocate for yourself with the health professionals.
Absolutely. And it's one great thing about Pulling Together because we do emphasize getting community. That's why we have the yoga classes that have it's not just yoga. There's a discussion portion where you kind of know what everyone else is going through, and you're hearing what they're going through. Even the online yogas also offer that, because sometimes hearing what other people are going through might be the same as you. It might be a little bit different, but it's giving you ideas of, like you said, to just ask your doctor, like, hey, could this be an issue that I'm having that we wouldn't really know? I have patients who were diagnosed with something like PCOS but weren't having any symptoms. Like, they would have never known until they weren't able to get pregnant and heard someone else mention it and asked their doctor. So it's why it's really good to see a reproductive doctor, because they already know, here's all the stuff we have to look at. So it seems like a lot of stuff that they're testing for at the beginning and a lot of stuff that they're doing, but they're looking at all these angles, assuming that whether or not you're having symptoms doesn't necessarily mean that something's there or not. So
it's a lot.
Yes.
It's a lot.
It's a very deep pool.
Yeah. Two things. I've already done one round of IVF.
Okay.
I have, they recruited 2 eggs, fertilized both eggs. One blastocyst is frozen, and one blastocyst did not make it to that last phase, and it perished.
Okay.
So I'm starting round 2 on Wednesday.
Okay.
And I currently have 5 follicles on the left ovary, 4 follicles on the right ovary. I have on my last testosterone patch.
Okay.
For the priming. I believe I'm to start estrogen today or tomorrow. I sent in a message to confirm the new protocol that's starting Wednesday. So I don't know if I'm taking a few estrogen pills up until that day. I'm waiting for them to message me back, and they're pretty good at that. What else is currently going on? Oh, so I've been on these testosterone patches for 2 weeks. This is the 14th one.
Okay.
So this is the last one. I think that's about it.
Okay.
Currently. So I'm just basically wanting to recruit more eggs. I felt very distressed about transferring the one and only embryo.
And while they'll tell you it only takes one, it's very stressful when you.
Thank you for saying that, because that was the response of so many people, and I'm like,
because they don't understand. Yes, it might only take one for you, but sometimes it takes 4. And if I don't have 4, it doesn't matter if I have 1.
And then if I wait until after we try what this one is gonna do, if I have none in the bank, what happens?
So it's definitely hard. It's definitely it's more common during the first cycle, because that you would either have a less amount. It could even be like the first IVF won't work, depending on the embryos, depending on the hormones, because if you think about it, they have a really small window to essentially, get your follicles, as many follicles as they can, grown in the time that they need to before they need to retrieve. And then if they were doing a transfer, you only have so much time to grow your lining. So it's a very limited window that they have to learn what your body responds with.
And my first round was a little bit dramatic.
Yeah.
They actually told me to stop stems 11 days in, and I refused.
Okay.
They were stuck at 8 and 9 millimeters.
Yeah.
And I'm like, I just paid a grip for this medication. Ain't no way in hell I'm stopping.
Yeah.
I'm going to finish this out. So I went home and I was like, I'm doing this. I showed up in the office 2 days later for tracking, and they were like, what is she doing here? Kept going. I had a 18, a 16, a 16, a 9, 12. So from that, they got 2 eggs. And so hindsight and during, you're learning as you go. And I didn't know how. I knew it was significant because I was taking all this medication, but significant as far as what the body can do and how much medication I was taking and how much trauma I was putting myself through. And even my RE, who's wonderful, she was like, yeah, you proved me wrong. Like, that's pretty freaking huge. Not only for me to have done that, I knew it was big when I was doing it. But for her to be like, I was shocked. I didn't know what you were doing. I was like, oh my God. And she's like, and you proved me wrong. And now that's like something she can share with future clients. Like,
it is really the case where when they look at it kind of after the first week of, if it's not developing where it should be,
right,
instead of them having you go through the whole process and then possibly not having a retrieval, they'll usually just tell you to stop early. So it is a more cautious approach. I have had patients who keep going where they don't have the results you did. So it's good that you did. It really is when your body starts responding to the meds. So it could have been that even at the beginning, your body wasn't not responding to the meds, but it was waiting. It didn't really kick in until after that. And that's also common.
Yeah. So we got those two. She said that she saw a third, but it was like kind of tough to get at. And I spotted during my protocol. So then that halted the transfer. So it wasn't in sync. The uterus wasn't in sync with the blastocyst. So they froze that one. And this might happen the same time this time too. So the idea is that we're not assuming that I'm going to do a fresh transfer. That's out. And that we are going to do a frozen transfer. So it would be the first one. So regardless of what we retrieve this time, we're going to do a frozen transfer. So she wants to prep my uterus, make sure it's exactly perfect and succinct with the frozen embryo.
And I think that's a really good idea, especially because you are looking to get a bank of embryos. So instead of just jumping right into a transfer, it kind of gives you a minute to see how many embryos you get and really be able to think about, okay, here's how many embryos I have. Do I want to do another retrieval or do I want to do a transfer?
I think this will be, I'm positive about this retrieval, and I would like a few children. I don't know how realistic that is for me at this very moment. I know that I want one, of course. Two, hey, I'm definitely game. As long as my insurance is at 100% co-insurance, I'm like, let's just go. So I don't know if I'm going to do another retrieval because I'm ready for a transfer.
Right. And that's also the hard part about doing a bunch of retrievals is you want that pregnancy.
I didn't know that was a thing, embryo banking. And I was like, well, what if we don't do the transfer? Because I was about to transfer. I was like, well, what if I want to do, like another round, is there a protocol? How long do I wait? What's the space? And she's like, well, if you do the transfer and then you get pregnant, you have to wait 6 months. So I'm like, that's like 14 months from now. We don't know where my hormones are going to be, how many eggs are going to be floating around, if I can still do an IVF at 47 years old.
Technically, as long as you haven't started menopause or gone through menopause, you can get pregnant at any time. But to do an embryo retrieval at 47 is going to be a lot different than doing it now. Because just every year your body gets closer to...
So the stimming is not the issue. It's the retrieving of what you've stimulated.
Well, right. It's how much is going to be stimulated. So as we age, the kind of... So you only have like so many eggs.
Right.
So as we age, the egg reserve goes down. So every year, it's going to go down a little bit. So even waiting from like right now to next year, it's going to go down a little bit. So kind of if you were to do a transfer to have to then wait 6 months, even at that point, it could go down a little bit just because. And it has nothing to do with, because you're in your 40s, it has to do with just the aging factor. So if you were even like 33, I'd be telling you, yes, even next year, your egg reserves will be a little bit
same
less.
For each age, just different reserves at each age.
Correct.
Got it. Okay.
So I do have to pause really quick. I have to pull needles on a patient.
Sure.
So
okay.
Otherwise, she's gonna.
Okay.
So
go.
I'll be right back.
Yes, no problem. Oh my gosh! Can you see the anxiety because I keep scratching my nose? My nose tickles when I'm excited or nervous or anxious. It's tickling right now. It's like somebody's got little hairs or feathers right there or something. So I'm hoping this is informative. Gosh. Needles. I'm going to have needles in me shortly. Yikes. I'm going to take my shoes off. Oh, I need to relax. Oh. I like her. I like her disposition. I like her vibe and her energy. I am looking over there at lots of essential oils. And I'm looking at what I think is needles. So, yeah. At some point, I'm going to disrobe and have needles poked. Okay, I'm ready for this. I'm okay with this. I will receive this, and it will be a great experience. Is that the truth, Ruth? Yes, it is. It's the truth. Oh, gosh, I need to stretch. I did not do any yoga stretches yesterday. Shame on me. Okay. I think I want to set this down. I am not... I don't know if I don't know how I'm gonna take this acupuncture. Oh my gosh, needles. That's the table. Uh-oh. And there are the essential oils over there. I'm sure those needles are over there too. So I'm gonna set the camera right here. Hopefully she comes back in here quickly. I did not eat breakfast. I should have. I gotta start getting up before I need to just get dressed and get out the door. I've got to give myself more time to leisurely get dressed and walk out the door, especially on a Saturday. But here she comes. Weekday mornings, goodness gracious, I'm not the one to get up, make coffee and sip on it and watch the news and get dressed and leave. That ain't me. But I need to do something, because getting up and running out the door is just not the deal. Oh, I'm having deja vu. Wow.
Okay, sorry about that.
No problem.
Just always running around. Okay.
Okay.
So where were we? Yep, frozen embryo transfer later.
Yes.
Okay.
Sometime November.
Yeah. And then you have your retrieval on Wednesday, so that's gonna be fun.
Well, I start stems Wednesday.
Okay.
So, I went 20 days last time.
Okay.
So we're looking at the end of October for...
So you haven't started stems and they're already seeing follicles?
Yeah.
Okay.
I had a baseline blood and ultrasound yesterday.
Okay.
So I'm on cycle day 5, I think.
Okay. So...
4, like maybe 4. Cycle day 4. So there's antral. Is it antral follicles? Yes. Okay. 5 on the left, 4 on the right. A lot more than I did.
Right,
the last IVF cycle.
If you're already seeing that many, it might not be that you do stim for 20 days. So.
Oh, that she did say that. She did. Okay, yeah, I'm remembering that. Okay.
Okay. That's why when you said you already saw 5 or 4, I was like, oh, okay.
So yes, there's a total of 9.
Yeah.
Yeah.
Okay.
Okay, yeah, it's making sense. You learn each time with each one.
And every one you're going to learn something different
because the uterus is just so...
Yeah. Uterus is...
Yeah, it's complicated.
It's like that passive-aggressive friend who's just, like, kind of nice, but, like, not really nice. And you're just like...
That's a perfect description.
And you're like, come on.
Like, I didn't know that about you.
Like, that's your uterus.
Right. Okay, so if I'm already seeing so many now, I might not have to stem for so long. Okay.
Which will be a lot easier on your body as well. Just because the stim meds are really intense. It's a lot of medications. Like, there's no ifs, ands, or buts about it. Like, it's a lot of hormones. So.
And it's not that I didn't know it going in, but looking back, I was like, I see why she said stop.
Yeah.
And I'm just like, let's keep going.
And you know what? And that's fine. There's just a lot of people who either can't go 20 days or, like, just don't want to go 20 days. So.
I guess I was just beast with it because I'm like, nah.
You know what? Because you were motivated and you just felt something that... Yeah. And it's one of those things, too, where as much as anyone that you're going to see that's going to try to help you, they can tell you what they know, what they've read, what they've learned, what they've seen, but you kind of know your body the best. Like, you're going to know if something feels off.
Yes.
And we might not be able to figure out what it is, but you're like, no, it's like something feels off.
Yes. So. True.
It's kind of like when you go to the doctor and you're like, I don't feel right. And they're like, oh, no, you're fine. You're like, wait, no, I don't.
Yeah, I don't like that either. But I love Dr. Jelani because I just love her. She's great. She, allowed me to continue because as a partner, she could have said, we can't allow you to do this, or this is not how I do my practice, or, it could have been a myriad of things.
Absolutely.
So I'm glad I just landed where I landed and I didn't have to keep searching for someone. And a couple people have said to me, all this to get pregnant. And people are getting pregnant by accident, by circumstance, by one-night stands, and it's like...
Right?
Even those folks had a 24-hour window. Oh, my God. And that's a bullseye.
Like, I don't understand how, like, they're, like, drunk 20-year-olds just, like, get pregnant. Like,
yes.
How? Like,
how did you hit that bullseye?
Because when you're trying to get pregnant, they tell you don't drink. Like, eat healthy. And then you have just this college kid who's just like, I'm wasted and I'm going to get pregnant. And that's just... Yeah, no, it's
and people get pregnant on birth control. With tubes tied.
Yeah. No, it makes it very frustrating, especially when you start the journey of, I want to have a child. This is what I want. Because you start that journey. You start going down that path. And you never know how that journey is going to be. Yeah. So definitely finding people that are kind of just up for going on that journey with you and recognizing that it's your journey. I'm a passenger, you're the driver. And
I've had more virtual support in that sense than physical people around me. There are several people who know that are like physically in my circle, but my circle has kind of dwindled down either because people aren't available or aren't willing to be available for it. It is a roller coaster. And some people just want to like peep in, hey, you pregnant yet? And then peep back out. And then some folks, this is what I'm living and breathing every day.
Yeah.
Whether it's something that I can't eat or shouldn't eat or need to eat or taking a pill, or it's an everyday thing. And I know that can be off-putting or unattractive or overwhelming for other people. But a lot of my typical circle has just kind of faded to the bag. And it's like, okay, well, all right.
Because it's really hard unless you've gone on that journey yourself or like been with someone and watched them go on that journey.
Right.
To really understand how involved it is.
Yeah.
It's not just a one and done process, which a lot of people think that, one, pregnancy should just be you have sex one time and you get pregnant. Like, that's it. I don't understand why.
I've gotten that natural question so many times. Why can't you just do it?
Or like, have you tried? Like, no. No, I haven't. I was just like, let me just shoot myself up with some hormones because that's what I thought would be fun.
Right.
But then also they think that if you're going to see like a reproductive doctor, that it's just going to be, you're going to go see them once and they're going to somehow just get you pregnant one time. So it creates a huge disconnect.
Yes.
Because, and it's not anything you've done, it's not anything they have done, it's really just the information that's out there. And unless you're kind of in the midst of it, like, you have no idea what's going on. And
it's like when you're in college and everyone has a different major.
Yeah.
You know, we're in different classes. We don't relate unless I can tell you what's going on in mine. You've got your classes, I've got my classes.
You'll still have that history major who can really help you study for your biology test because he knows more about it than you do. There's always that person. That's your passive-aggressive friend.
That's kind of true. That's funny.
But, yeah, I mean, you're always going to come across these things where it might be that people that were in your closest circle start fading away. It might not be permanently, but at least for this point, if it's people who don't understand what's going on, it's probably better.
Yeah.
That they're slightly faded away. It doesn't make you feel better because it still sucks.
Right.
But it's better to, instead of having to like explain and have people still not understand and just be like, I don't understand why you're so emotional. It's like, I'm shooting myself up with a bunch of hormones. Like, I understand your estrogen is at like 12, mine's at 500. Like, do you want to talk about it?
Facts.
So they're just, it's like they're incapable of understanding because they just have no idea.
Yeah. I told, someone texted me. They're like, hey, what's going on? And I'm like, how do I answer that? I don't want to say too much. And then I want to be honest.
Right.
And it was someone who I'm honest with. And I said, well, a lot.
Yeah.
Well, like what? Boom. Okay. 1, 2, 3, 4 bullet points. Oh, wow. I had no idea. You usually tell me this kind of stuff. Well, this isn't something I can text.
Right.
You know, it's, you know, and who wants to say, how you doing? And okay, whoa, I wasn't expecting all of that.
Right.
So you don't want to regurgitate on people. And then there should be some that you should be able to do that with if they're true friends. So it's like, okay, I think I'll just, if they're fading them, they're pulling back, maybe I'll just, and I've just completely just backed away.
Well, and I mean, it's one of those things too where, yes, you're trying to get pregnant now, but when you are pregnant, it'd probably be the same thing just because,
oh yeah,
you know, even one person's pregnancy is going to be different than another person's. And, you know, trying to explain to them just, you know, how you feel with having all these symptoms. They're still going to be like, well, is it that bad? And it is.
That's already something I'm training myself not to do because the first time I hear, well, this is what you wanted, I'm going to fight.
Yeah.
Physically fight. So I'm already training myself on how to answer questions without sounding like it's a complaint.
Right.
And it being thrown in my face. Well, you wanted to have a baby.
Right.
Oh, you think it's hard now? Wait till that baby comes. I've already heard that statement.
God, that statement.
And I'm like,
it's like the worst statement ever created.
Yeah. So I agree with you that it's probably best that people have backed up. You know, it's a small circle, but when those few fade away for whatever reasons, for their own personal reasons, or if it's because of me and my journey and where I am in my life right now, I get it. So it's probably best, but it hurts like hell. And it's causing me to have swelled emotions and compiled and compacted emotions. So,
well, and then taking the hormones are just going to make those emotions
right. And it's like, okay, well, I had a problem with that before I had my hormones with certain friends' behavior, so it's just exacerbated. Yeah. So, yeah, I'm hoping acupuncture will help with that too.
It will. It won't fully get rid of them, but it helps how your body physically responds. So it's not going to say, I'm going to get rid of all the stressors in your life.
No.
I mean,
right.
I could lock you in a box, but you'd still be stressed.
Yeah.
You'd be locked in a box.
Gotcha. Okay.
But it's going to change how your body responds.
Perfect.
So it's not necessarily teaching your body to cope with it, but just teaching your body better alternatives to be like, this is what's happening. Like, it's fine. It's not the end of the world.
Okay.
Because a lot of times when you're on all of these hormones, everything feels like the end of the world. It's like Googling your symptoms. Like, you're always going to end up dying. Like, no matter what you Google. Like, I have a cough. Oh, you have pneumonia or you're going to die.
Okay, gotcha.
So, that's kind of what it is when you're on hormones and you have anything else stress-wise or emotional-wise going on in your life. Because it's just going to, like you said, it's just going to make them even, you know, stronger feelings and even stronger stress. And that's not the type of situation you want your body going through.
Yes.
even outside of being pregnant. Like,
yes,
you want your body to be this very, like, zen area.
Okay.
Which makes it even weirder that the drunk girl in college gets pregnant. Because
right.
But it is going to be hard. I think it's great that you have the online community.
Yes.
I know there are a lot of online groups that help with supporting people through it. And
yes.
It really is a tool, because when you go into that fertility office, like, even when you come into here, you're kind of just sitting in the waiting room by yourself, waiting for
yes.
someone to call you. And
I experienced a lot of emotions in the waiting room.
Yeah, it creates a very...
It reminds me that I'm by myself.
Yeah.
It reminds me that it's just reminders.
It creates a very lonely feeling. And even if you were going there with a partner, it's still just you two.
Yeah.
And it creates a very lonely feeling, and then throwing hormones on top of that just makes everything more fun.
Yep.
Hormones are just fun.
Yes.
But it's very common to kind of feel overwhelmed emotionally during this process. And it's very common that people do start to fade out of your life. And like I said, it won't be permanent.
Mm-hmm.
But at least for right now, it's probably going to be for the best. Because if they're not going through the same situation as you, they're going to say things like, it only takes one. Mm-hmm. They're going to say things like, well, have you tried naturally? Or like, this is what you
I've gotten several DMs from guys like, you haven't just tried the natural way? Is this an invitation?
It probably
It's
is.
like, come on, dude, seriously?
Yeah. No, never thought of that. Never. No, thought never. Thank you. Thank you. Where would I be without you?
Right.
But so it's a lot of comments like that, a lot more of like people not understanding. So definitely having a group that you can go to that are going through the same thing.
Yeah.
It's going to be super important, because they're going to understand exactly what you're going through. They're going to understand, like, when you're on a certain med, like, you want to murder everybody because that's just how you feel that day. And that's fine.
Yes.
Like, you want to burn down your house because it's easier than cleaning it. Like, those are normal feelings.
Right.
So having someone who understands those is going to be a lot better just for your mental well-being, because it's taking away that, I hate to use the word, but it's just taking away that crazy factor. Because you start to feel like, am I losing my mind? Am I going crazy? Like, you're not. You're not. It's what the hormones are doing to your body.
Yes.
And so you have to keep telling yourself.
Yes.
Like, I might cry because this leaf fell. It was the most beautiful leaf that fell ever in my entire life. And it's normal.
Yeah.
It seems really weird.
Yeah.
But it's normal.
Yes.
I have a patient who just last week was watching a Kindergarten Cop, and she cried at the end, and she's like, so, remember you talking to me about these emotions?
Yes.
I cried at the end of Kindergarten Cop. I'm like, yeah. Like,
yeah, they come out of nowhere. Yeah.
Yeah.
And they're random. Yes. Mm-hmm.
You'll just be in traffic and then start crying.
Mm-hmm.
No. It's just getting you ready for when you're pregnant.
Yeah, I guess so.
Because it'll be the same thing.
Yep. I've seen it happen. I'm a nanny. And a private childcare consultant. So I've seen different sides and different portions of what parents are going through, whether it's trying to look for a nanny, hire a nanny, whether it's having a nanny, and me watching my clients be pregnant, and you know.
And it kind of makes it harder. It makes it a lot harder.
Yeah.
Jobs like being nannies, being like babysitters, being teachers at the lower ages. It'd be good if you're like a high school teacher, because they're all terrible.
Yes.
But it makes it a lot harder because you can physically see what you want.
Yeah. And
it makes that journey a little bit harder.
Right.
And then seeing other people get pregnant, just, my husband sneezed and I got pregnant. And
yes.
It really makes you start blaming yourself or questioning. Like,
yeah, I really went through a long bout of, why didn't I just do this earlier?
Right.
Or not just got knocked up by anybody, but,
Or is it, this one time when I was 20 that I did this, is this why, like, am I being punished and this is why I can't now? They're very common thoughts.
Yeah.
Yeah, I'm sure
uncontrollable, yeah.
Yeah, I'm sure you'll get them in your group where it's a lot of self-blame.
Yeah.
And especially when you are going with a reproductive doctor, the great thing that they're doing is the sperm that they're using, they're testing it first. Because, yes, while sometimes it is the female that has an issue going on, about 40% of the time it's the male.
It's 40%. That's a lot.
Where it's it's either a change in sperm count, where they have low sperm count, low motility, low morphology. Yeah. There's a lot of things, and that's just saying, and that's beyond the point of just the sperm just not working genetically with what.
Yeah, because all the testing that you have done, and people are like, well, I didn't have all that done when I got pregnant. It's like, not worried about that. Well, since you're doing it on purpose, they're testing it and making sure. I had to have this line of genetic testing done, and the sperm donor check theirs to make sure that there's cross matches and no cross contaminants or know.
And you never think about that when you're trying naturally. Like, you don't think like this person's sperm might not work DNA wise,
right?
And it might be that there's absolutely nothing wrong with you, but the issue is the sperm is not matching the DNA.
Nope. Yep. It's yeah.
Explaining
that is tricky too.
Oh yeah. No one understands that because there's never anything wrong with men and their penises. Like, nothing ever. Like, I'm surprised the sun doesn't rise and set there. Like, there's nothing ever wrong with them. So yes,
good one.
There's never any issues there.
Yeah.
And if there are, they're just wrong.
Right.
But no, so it is really good, especially when you're not having someone who is going to go get tested that you still try naturally with. That, I mean, and even if they would, it's still not guaranteeing that it will work. So definitely doing it this way where they can look at the embryo, see what's growing, see what's not. It's also going to eliminate a bunch of time. So it could be that every month that the sperm is kind of just meeting with the egg and implantation.
I think about the time I wasted trying like that, and I was like, okay, no.
Right. Well, because you don't think about it until later on, where you're like, oh, so maybe this was the issue all along, and it didn't matter how many months you tried, because it's just once that the sperm and the egg meet, if the DNA isn't right, it's just not going to go. Yeah. The great thing about doing like an embryo transfer is that they're looking at, we've grown these for, sounds terrible saying grown, but we've let these kind of do their thing for like 6 days and see what's happening and look at where they're at, and it's, is this DNA working together? Is it not?
Right.
So it gives you a little bit better of a chance. So that's why when you can have people who have like 10 embryos that make it, but then once they get to day 6, there's only like 2.
Ooh, yeah.
Fun, right?
Big fun.
So anything else going on that's concerning to you besides?
No.
Okay.
Nope.
Any side effects of medications?
Not this current one. Not the patch.
Okay. We'll find out on Wednesday.
Yeah.
When you start the new ones.
Yeah. Extremely high sex drive lately.
Yeah.
Like, way high.
It's gonna be the progesterone. Fun.
Yeah. It's been hot up under the collar lately.
No, that's common. It's okay. Then you'll start feeling bloated when you're doing the stim meds, and you'll be like, no one touched me.
I bloated up the other day, and I was like, oh God, here it comes already. I'm like, I look 5 pounds, 7 pounds bigger.
Yeah, and definitely doing any type of weight loss is near impossible at this point with the hormones, just because they're going to be creating bloating and you're going to retain water.
Because I just lost a lot of weight.
It's not going to make you necessarily gain weight, but if you're trying to keep losing weight, it's going to kind of hit that plateau. So if you like get on the scale and you're like, I haven't lost any weight in a couple weeks, don't be concerned because you're going to get a lot of bloating, a lot of water weight that comes with hormones.
Because I look back at my videos and I'm like, God, I look fat. I'm like, I just lost weight, but
it's because it's water weight, so it's not even like fat weight.
Okay, yes.
It's kind of like right before your period.
How many pounds can you be of water on you?
You know, I don't know the exact answer.
Okay. Can it be between 5 and 10 pounds?
Oh, I'm sure.
Okay, that makes me feel better. Because I got on the scale and I saw a number and I was like, that's not right.
Yeah, no, I'm sure that it could, because I know there's this really terrible diet called the rice diet, which is like literally just eat rice and like,
oh hell no,
and like boiled chicken with no seasoning. It's, like I said, it's terrible, but you lose all your water weight and you'll lose like 10 pounds like in a week because it essentially just flushes all your water.
Oh wow,
it's a terrible diet.
Yeah, rice.
My mom does them before weddings. Oh my god. Just like I have to get into a dress, so.
Your mom.
Don't worry, my mom is a whole different ball of...
Okay.
Yeah.
So what's next?
So have you had acupuncture before?
I have never.
Okay. So this
and I'm starting. If you see me itching, it's because I have anxiety not to start.
Oh no, it's fine. It is the insertion of needles. It's literally the name. It's in the name. Acupuncture.
Ah. Yeah. Okay.
They're really thin needles. Most of the time, you won't even feel them.
I've been jabbing myself so I'm just like, okay.
These will be the easiest needles you feel. Like you barely will feel them. We're gonna do some in your abdomen, some in your arms and legs.
Okay.
You're not gonna really feel them.
Okay.
And essentially, what we're gonna do is we're gonna put them at specific points to elicit certain responses at the body.
Okay.
And then we leave them in there so they continue eliciting these responses while you kind of relax. So even
that sounds like an oxymoron. But okay.
Oh yeah, no. You just wait. First time is usually the hardest to relax because all you're doing is thinking that I'm laying here with needles in me.
Okay.
Usually after that, it's a lot better.
Okay.
Do you want to? So you will be laying down for like 30 minutes. Do you want to use the bathroom really quick?
Oh. Yes.
I was gonna say, if you're not sure, you should try.
Yes. Right. Okay.
Because yeah, I've had a few patients where as soon as I put all the needles in, they're like, so
be right back. I'll just start another video.